Everyone, I'm Dr. Brianna Schuler, and I'm going to talk with you a little bit about ethics and psychology. So, why am I having this conversation with you? Well, as psychologists, we are constantly faced with choices, judgments, decisions, and ethical dilemmas in our personal and professional lives. When we face a serious ethical concern, we are motivated to make the correct moral choice, and we search for some kind of reliable guide or manual to do so. This is why scholars have spent centuries devising systems of rules or ethical codes to govern our personal and professional behavior. So, what even is ethics? Well, according to Bersoff and Kopel, this ethics is the study of the assumptions held by individuals, institutions, and organizations, and professions that help distinguish between right and wrong and ultimately help us make sound moral judgments. So, why should we be teaching you about this idea of making sound ethical judgments? Well, whatever you want to do, whether that be research, working with patients, working on a social media team, or interacting with customers, if you interact with other human beings, you will need to make ethical decisions. The second reason we teach you ethics is we can't assume you will always be uh, prepared or exposed to every type of scenario before you walk into it. So we want to make sure you have that sound background first, because you never know what may end up on your plate to make the decision. Because there will be scenarios where you may not be able to rely on a supervisor or someone who has experienced it before. So, for example, let's say you are working in a clinic or hospital and you have someone come up to you in a session or in an emergency room setting with some concern, be it drug use, potential abuse, whatever it may be. In those scenarios, you may not have the time or availability to reach out to someone else to ask, hey, what do I do? Uh, while, yes, we always want to be able to rely on us supervisors, there may not be that kind of time. So we want to make sure you're aware of the thought process to make in the scenario that you are not able to rely on other supervision. And as Benjamin Franklin said, by preparing to fail, by failing to prepare, you're preparing to fail. So we want to make sure you are prepared for success instead. We are going to talk through some scenarios to help you think about how we conduct ourselves as psychologists and how we can approach that from an ethical standpoint. Through this repetition, we will work on this idea that ethical thinking is a skill that must be developed. And we've learned a lot about how to develop and approach things in an ethical way by learning from our past. So that brings me to some studies that I want to discuss with you, where we learned the hard way the potential ramifications of not making the most ethical choices, even if it wasn't meant to be unethical at the time. So the first study I want to discuss is what we call the Little Albert study. In this 1919 experiment, the researcher, John Watson, wanted to understand if a phobia could be trained or taught. In this scenario, he brought in an infant and presented the infant with a white rat. He would then bang a hammer on a metal stick to make a loud noise and scare the child. By repeated repetitions of this banging, it got to the point where the child would see this animal and react with that same fear response and start crying. In fact, it expanded outwards to the point the child would see another kind of animal, like a rabbit, or a face mask that looked like an animal, and would have the same startle and cry effect. This study brought in some really important ethical concerns, such as they did not uncondition little Albert afterwards. So he was taught to have all of these fears and then sent off into the world and was forever afraid of these animals. This really brings this into question of how are we treating our participants or our patients, and how are we thinking about what happens to them after they walk out of our studies or outside of our workplaces. Another example study that I really want to address is the Milgram study. For some time frame context, this was conducted in the 1960s, which was just post World War II. where researchers really wanted to understand how scientists could justify the Nazi experiments and acts of genocide that had occurred. In this scenario, there were three people, only one of which was an actual participant. So the participant would come in and sit at a desk that had an electrical box. On the other side of the box was a person they thought would be answering questions and being electrocuted according to their answers. As a note, this person was actually an actor and they were not being electrocuted, but the participant was not informed of that. The third person in the room was a scientist who would prod the participant to continue to shock the actor. So, for example, the participant would shock the actor the first time they answered incorrectly, and keep pushing and pushing with a series of prods to make them continue to shock this person, perpetually increasing the voltage. So this would start with a prod, saying, please continue, or please go on. Then they go on a little bit longer, express feeling uncomfortable about what this actor was expressing in terms of pain or discomfort. And the scientist would prod again. The experiment requires that you continue. Next, it would be turned up to, it is absolutely essential that you continue. And then finally, you have no other choice. You must go on. In this scenario, they ended up learning that all participants continued up to what they thought was 300 volts of electricity, and 65% of the participants continued to the highest level of shock, which was 450 volts, where the actor would start acting unresponsive. As you can probably imagine, this was incredibly traumatizing. And yet again, we did not consider things like what happens to this participant after they walk out the door. There was no debriefing process in place to let them know that it was acting and they had not really harmed these people. So these participants were walking out crying, trembling, sweating, having actual panic attacks, and left in that state. Additionally, they were never told that this was an experiment that they could walk away from. They did not have this informed consent in place to protect them. The final study I want to talk with you guys about is the Tuskegee syphilis experiment. This was conducted between 1932 and 1972 by the U.S. Service of Public Health in a historically black college in Alabama, which was then called the Tuskegee Institute. The research project was trying to understand the development and processes of syphilis, which at the time was a very deadly disease. They enrolled 600 African American men, 399 of which had syphilis, 201 did not. However, none of these men were informed if they did or did not have syphilis. At the time of the study, they were told that it would only be 6 months long, and they were not allowed to seek any other medical assistance beyond that of the research team. Instead of it only lasting 6 months, it ended up lasting 40 years. So there were people dying from this disease throughout this process. Additionally, they were spreading it to their friends and their families. And most horrifically of all, during this time, they learned that penicillin was an effective treating method for syphilis, but none of this was shared with the actual participants. So instead, they continued to die over these 40 years without being provided actual resources because it was beneficial to the researchers to learn about syphilis, and there was not the respect given to the actual participants. As you can imagine, this violates so many ethical concerns, and really spurred on the need for some sort of guidelines or limits for research. And that brings us to the Belmont Report. So in order to address some of these studies that really raise ethical concerns and recent legislation on that front, the National Convention for the Protection of Human Subjects of Biomedical and Behavioral Research created the Belmont Report in 1979. The main three principles that were published in this report were beneficence, respect for persons, and justice. Beneficence is the idea that individuals participating in research do so voluntarily, um, and that they will benefit from it. We want to maximize all of the benefits and minimize the risks. So completely against what we just saw with the Tuskegee Institute. Next, we have the respect for participants, where again, we want participants to be treated with respect and kindness, and they are not being coerced into these studies, and they're provided with information about them, aka they're given informed consents. The final aspect of the Belmont Report was justice, which was the idea of equal distributions of burdens and benefits of research. Recruit participants that will be most benefited and relevant rather than just being convenient. So think back to that Tuskegee Institute study. The patients or participants were receiving horrible treatment and it was benefiting someone else instead. So this idea of justice wants to prevent that kind of unfairness. But the guidelines did not stop at the Belmont Report. In fact, multiple fields created their own ethical guidelines to take this kind of information and apply it specifically to their field, including the field of psychology. So, to govern this psychology research and psychology treatment, the American Psychology Association, aka the APA, created a set of principles which we call the ethics codes. These ethical codes guide all individuals connected to psychology, from college professors to researchers at a medical development company to counselors. And they provide guidance on how to conduct ourselves within our field. These ethics codes have two major components, the principles and the standards. The principles are not enforceable rules, but should be considered when you're making any ethical decision. So let's begin by looking at these 5 principles before briefly discussing the standards. The first principle is the principle of beneficence and non-maleficence. Very similar to what we saw in the Belmont Report, but the ethical codes state that psychologists strive to benefit those with whom they work and take care to do no harm. In their professional actions, psychologists seek to safeguard the welfare and rights of those with whom they interact professionally and other affected persons, and the welfare of animals. So again, this is that idea that we want to make sure we are creating as much beneficial information to the participants and reducing the chance of any possible harm. Principle B addresses fidelity and responsibility. In this principle, psychologists establish relationships of trust with those with whom they work. They are aware of the professional and scientific responsibilities to society and to specific communities in which they work. Psychologists consult with, refer to, or cooperate with other professionals and institutes to the extent needed to serve the best interests of with whom they work. So this is getting at the idea of we work as a team, holding each other accountable and supporting each other. In this scenario, we are the first line to catch any potential concerns and provide guidance and help to our colleagues to make sure that we are ensuring not only our participants or patients are treated ethically, but so are anyone that we come in contact with. Our next principle is the principle of integrity. In this principle, psychologists seek to promote accuracy, honesty, and truthfulness in the science, teaching, and practice of psychology. In these activities, psychologists do not steal, cheat, or engage in fraud, subterfuge, or intentional misrepresentation of fact. We strive as psychologists to keep our promises and avoid any unwise or unclear commitments. We want to make sure that the general population can have faith in what we say, because we hold ourselves to the standards of doing the right thing and being honest. The next principle is the principle of justice, which states that psychologists recognize that fairness and justice entitles all persons to access to and benefit from the contributions of psychology and to equal quality in the processes, procedures, and services being conducted by psychologists. Again, very similar to the principles discussed in the Belmont report, but we're wanting to make sure that we're treating our participants fairly, selecting them fairly, and avoiding any potential biases based on things like convenience or uh, hidden or unknown expectations. Finally, we have Principle E, which is respect for persons' right and dignity. In this principle, it states that psychologists respect the dignity and worth of all people and the rights of individuals to privacy, confidentiality, and self-determination. Psychologists are aware that their special safeguards may be necessary to protect the rights and welfares of persons and communities whose vulnerabilities impair autonomous decision-making. So we need to be aware of potential concerns that could go in with any demographic to make sure they're being treated correctly. For example, in the Tuskegee Institute study, they specifically targeted a population that did not have the same access to healthcare and did not have the same insurance and options to make sure that they were receiving proper treatment. This principle is ensuring that any population, such as an older adult population, any unwell, such as cancer patients, children, any population that might be at extra risk is protected with additional safeguards. So let's take a quick quiz. A therapist is asked by a patient's father for information about her sessions. Which principle is this situation most relevant to? Principle B, Principle C, Principle D, or Principle E? All right, if you selected Principle E, the principle that individuals have a right to privacy, confidentiality, and self-determination, you would be correct. I do want to say that you may notice that other principles could kind of apply as well. So for example, in this scenario, Principle A, which addresses that idea of avoiding harm, could also come into play, which is a really important aspect of these principles where we're layering levels of protection. Lastly, let's address those ethical standards. So the ethical standards are enforceable rules for conduct, but are written broadly in order to apply to the varied roles that psychologists have, be they clinician, teacher, researcher, or otherwise. These standards are not exhaustive. However, just because a topic isn't covered, it does not mean that it's either ethical or unethical. But let's quickly list through the 10 standards that are addressed in the Ethics Code. The first addressed is resolving ethical issues. The second addresses competence. The third addresses human relations. The fourth addresses privacy and confidentiality. The fifth addresses advertising and other public statements. The sixth addresses record keeping and fees. The seventh addresses education and training. The eighth addresses research and publication. The ninth addresses assessment. And the 10th addresses therapy. Each of these standards does go into multiple facets within each aspect. So to look at one of these as an example, let's dial in to our fourth standard, privacy and confidentiality. So the first section within this standard is the aspect of maintaining confidentiality. It states that psychology have a primary obligation and take reasonable precautions to protect confidential information obtained through or stored in any medium, recognizing that the extent and limitations of confidentiality may be regulated by law or established by institutional rules or professional or scientific relationship. So for example, thinking about things like how are we storing data? How are we storing any information about our patients? We're not doing things like having a file about a patient just left out in an unprotected area. We're making sure that their information and privacy is respected. As a note, we live in the 21st century, so there are additional ethical challenges that come into this aspect of confidentiality. So first, let's think of telehealth and other online services. we as psychologists will increasingly face expectations by our clients to provide services in the context or preferred methods of communication that they need for their scenarios. So beyond just having to think about face-to-face confidentiality, we need to think about things like phone calls, texts, emails, Zoom calls, and more, regardless of our career path. So one example that I have worked with in my own research is there were apps that could scan participant movement and guide them through a series of different movements, stretches, etc., to analyze risk analysis. But if all of this scan is done on an iPad, how are we transferring information from the iPad to a protected server in a way that is ensuring that participant or patient's confidentiality? Additionally, we need to consider the contracts or agreements that are in place for providing services. So what competencies do we need to make sure are in place if we're going to offer service remotely? What new factors will constrain confidentiality protections? For example, even something as simple as making sure there's no one else in the room when we're meeting with our patients or participants can make a huge difference. Additionally, who all has access to these uh, data and the different practices we are involved in? This is particularly complicated as we have to parse our ethical obligations to individuals, to groups, and to society at large as our influence grows. So let's just look at this at the individual level first, because I think it's the simplest. We must consider the principles of beneficence and non-maleficence, fidelity, and responsibility. We have an obligation to care for our participants and our clients. We have to be aware that legislative mandates could cause us to break our confidentiality. So, for example, if someone comes into the hospital with a gunshot wound or reporting abuse, we need to be aware of how we handle the ethics of reporting that information to the correct authorities. Our next obligation to address is our groups level. So this refers to couples, families, and other groups like coworkers. Groups are more complex because in the scope of practice, you may determine that what benefits one individual can harm the other. And we have to anticipate these potential concerns and try to avoid any possible problems while being mindful of things like informed consent and privacy. Then finally, there's this aspect of being obligated to our third parties, such as insurance, judges, lawyers, employers, and government agencies. This can present a conflict of interest because you may feel pressure from a third party, like an insurance company, to act in a certain way, such as providing a poorer treatment that's approved by the insurance because that treatment is provided by the insurance, whereas a better treatment is not covered by the insurance. You must be able to navigate these systems in a way that's ethical, legal, accurate, and beneficial to all parties to the extent that is possible. So, to kind of take that a step back, what happens if you are in a scenario that you are experiencing an ethical concern? So first, really reflect on, is there an ethical concern? Look through and consider some of the material we discussed today. What violations may be occurring? Taking that into our second step, consult the guidelines. If there are areas that are being crossed, what are the mandates for how to handle that type of ethical concern? Next, consider some of the important factors around that scenario, such as any potential biases that could be going into how you're approaching the scenario. What are some of the financial implications or cultural differences that could be influencing it? Then I would suggest consulting a colleague, preferably someone who has a bit more experience, specifically with this type of scenario. Get as much advice as you possibly can on how to approach these types of problems. Next, consider the affected parties. Evaluate the rights, responsibilities, and vulnerabilities of all the potential stakeholders that we discussed on our previous slide. And the sixth step, generate decisions. Don't think about any of the complex aspects, just create a list of all the possible approaches and the ways they could treat this ethical concern. Once you have this list, you can go through and start addressing the actual consequences of each of these specific approaches, such as the psychological, social, or financial ramifications of using that uh, decision to guide your approach to the ethical concern. Then finally, after you've considered all the possibilities, you can make that actual decision. These can be really complex scenarios, and we don't want you to feel abandoned to make these really hard decisions on your own. So always reach out to your colleagues, to your superiors, review those ethical standards and guidelines that are all provided on the APA site. And remember, at the end of the day, we want to treat people like people, and everyone deserves the utmost of our respect. I have all the faith in you guys, and hopefully this helps consider provide you with considerations for when you're next making an ethical choice. Thanks for listening.